Welcome back. We are answering your questions about the coronavirus and stress with Cone Health's Chief Physician Executive, Dr. Bruce Swords, and Clinical Director of LeBauer Behavioral Medicine, Dr. David Gutterman. Remember, you can text your questions. The number right there at the bottom of your screen, 336-379-5775. All right, tomorrow is Election Day. Should people be worried about COVID-19 while voting? Dr. Swords?
The answer is yes. Good evening. And really, folks should be thinking about their risk and exposure no matter what they're doing, and that includes voting. So if folks are in line and close to each other, absolutely people should be concerned about catching the coronavirus at that time and doing the normal things to avoid it. Stay away from each other, wear a mask, and voting should be safe, but it's dependent on those two things.
Okay. What steps can you take when you start to feel your own unhealthy feelings increasing to calm down, to de-stress, and to refocus?
Are we talking about while you're in line to vote? Or
It could be, or it could be towards the holidays. I think you can make it applicable to any of that.
You may not want to make a comment to the person in front or behind you while you're in line. But I think other than that, there is obviously a lot of tension and stress around COVID and being confined. And if you find yourself starting to get into an unhealthy mindset or just patterns of behavior, go back to your old reliable things, the things that have always worked for you, at least in the past. Again, whether that's exercise or music or reading. I think we're about to hit upon the holiday season, so things like old movies that are not political, they're not related to viruses, that are things that can instill good feelings. But I think it's important that we have to take care of ourselves, right, during these very difficult times. So those things that have been helpful to you to relax, stay calm, employ as many of those strategies as possible.
Someone is asking, when someone exhales smoke from a cigarette, can there be contagious droplets in that smoke?
I'll give you my opinion here. To my knowledge, that hasn't really been studied. I think the assumption should be yes. There's nothing in particular that would decrease the chance of coronavirus being in exhaled cigarette smoke than just normal breathing. So the assumption should be yes, and to my knowledge, it hasn't been studied.
Okay. What are the signs to look for that you or a loved one needs to talk to a professional?
Assuming a mental health professional, I think that if you find that that these issues that we're dealing with now with the pandemic are becoming so either obsessive in your own mind, you're thinking that you're unable to concentrate or focus like you typically might at work or at home. If you're finding that your emotions are more than just feeling stressed, but that are so fragile that you're not reacting as you typically might react. Everyone's going to have sad or worrisome days, but if you have days that are persistently sad, that last for prolonged periods of time, that would be an indication as well. Or if your worry or concern is such that you literally are just not functioning, reacting, or having any contact with people, those would be indications that it would be helpful to talk to a professional.
And is it one of those things of, even if you're not sure, just call the professional, and then maybe the professional can you walk you through a few questions to decide whether or not that person needs to go in and talk to someone?
Absolutely. If you call a mental health professional, you certainly can have a few minutes to dialogue on the telephone. Here's what's going on for me. Is this something I should be worried about or concerned about? And again, if it's something that would be helpful to talk to a professional, and sometimes in just a very few conversations, you can get some strategies and tips that'll help you manage through these really challenging times.
All right. Dr. Swords, this question is for you. Can we wear a surgical mask again after letting it sit around in a paper bag for a few days?
Again, general answer to that is yes. It's better to wear some face covering than others. I think having a mask sitting around in a paper bag for a short period of time, a few days, is fine. Make sure it's not soiled and in good condition, and it can certainly be reused and still be effective.
All right, we're going to continue taking your questions. You can text us those questions, 336-379-5775. We'll be right back.